program which consists of multiple projects. We have two sponsors. One of those is Mr. Cooper, who is our DHHS CIO, and our Deputy Secretary of Human Services, Sherry Bradsher. In addition, the people listed here are all of our stakeholders. So again, we've got our county workers, we have our directors of social services, our county commissioners, the General Assembly, taxpayers, recipients, as well as families that we're serving. And we also are one of those rare projects that has 3 federal partners that we deal with. We are working with the Center for Medicare and Medicaid Services. We're working with the Administration for Children and Families, as well as USDA Department of Agriculture. So getting all 3 of those working together to assist us sometimes can be challenging, but we are up for that challenge. So one of the key things that I've shared before is the challenges that we've encountered as far as the project itself and the program. We initially had started out with 6 projects. That was the original timeline. The first one of those was our Global Case Management and Food Nutrition Services project, which was Project 1. We were successful in piloting that project starting in May of 2012. We rolled out in March of 2013 to all 100 counties. And in May of 2013, we were successful in retiring the food stamp information system, which was our legacy system. So we continue to date. We are currently processing on average around 8,000 food nutrition service cases a month, which is in line with where we have been in the past. The big thing that impacted us is that due to the Affordable Care Act and healthcare reform, we had to move our Project 6 up, which is our eligibility replacement system, which is also referred to as the EIS. Also, in addition to that, because of ACA, or Affordable Care Act, we also had to implement Project 7 to build that interface with our healthcare.gov implementation. Part of the concerns and some of the challenges that we faced was because of the Affordable Care Act, it impacted our Project 2.6. As I said, we initially started out last year in July of 2013, and we were rolling out P26, but because of Project 7, we had to delay that rollout. We had 4 counties that we piloted with, so they have been engaged in NC-FAST for traditional Medicaid since that time. We delayed the rollout until July of this year for the remaining counties in order for us to concentrate on our Project 7, which was the Impact Affordable Care Act. As of October of 2013, last year, we implemented the ability for us to take applications for that traditional family and children's under the modified adjusted gross income, also known as MAGI ACA Medicaid changes. We continue to work with our federal partners as Project 7 has really impacted our counties as far as backlog and other, Sheila will talk to that in a few minutes of where we are with that. But with that, one of the things that we're doing right now to give you a current status is that we are in the process of rolling out P26. We have different stages. Right now we have the pilot counties, as I referred to, went last year. We had Group 1 that went successful in what we're calling the 2-stage process. First stage is all 100 counties are now currently, as of August 1, entering all their new Medicaid applications, whether it is their MAGI applications, which is the ACA Medicaid, or their traditional Medicaid and NC-FAST. We are working as far as stage 2, which as of August 4th, we implemented additional counties to come on board, and we converted their data from the legacy EIS system into NC-FAST. So they are 100% in NC-FAST at this point. We continue to work through the different groups. Our plan is to continue to roll out. We went this weekend with 27 counties. So far, we have been pretty successful, no big increases in our ticket volumes. We continue through the end of November 3rd. We also work with our counties and identified some of the key things that we did as far as the rollout that you're seeing on the screen was to look at how many counties were actually putting their information into NCFAS, so how much had they adopted NCFAS, where they were with their backlog, and then the size of those counties. We have to convert from our old legacy over into NCFAS over a weekend, so we have to provide enough time to convert those over in order to be back up at 5 o'clock on Monday morning. So this is to provide a current and future projects. Again, we are currently rolling out P26. We have additional P7 implementations that we'll be working on over the next year. There are additional requirements in addition to being able to take those applications. We're currently working with CMS to upgrade the account transfer between North Carolina and the healthcare.gov. We also have Project 3, which we are working on right now, looking at those core requirements, which is our VAP, Child Care, and SIP applications, which is Crisis Intervention Program. And then we are concentrating also looking into the future for our services program, which is Project 4 and 5. So some of the key challenges that we have encountered throughout the last 2 years predominantly have been improving our communications as well as working with the impacts that we have with the Affordable Care Act. As most of you know, there is a backlog within our counties. And what we did is we worked very closely with CMS and all 100 county directors to identify how we could work more closely together and bridge that relationship to help them as they encounter the impacts of that open enrollment. We are currently working as well to look at other ways for us to assist them with planning for the open enrollment that will start this year in November 15th, 2014. So we're working to try and help them as much as possible to kind of forecast what that will be. We're continuing to work. We meet with CMS every week to try and get clarifications of any other impacts that we may have. Other things that we encounter as far as challenges for NCFAS is our changing state and federal requirements like our MAGI or cost of living increases that we have for Medicaid and food and nutrition services. We're currently working on that. We have a food and nutrition services COLA that will come up October 1. So we're continuing to work through that and working with our counties. Key things that we've done since I came on board was to improve the communications with our directors. We've implemented the ability for our counties to have a voice. Before, we were looking at defects, change requests, and making those decisions based on our knowledge at the state level, engaging our divisions. What we did is we actually opened up and created a group that allows counties to have a voice to help us prioritize those defects, those changes, and also any improvements that they may see that they feel that we need to look at. So we're continuing to improve the ways that we're communicating. We have monthly meetings with directors as well as key staff and continue to work very closely as we roll out with our projects going forward. Another thing that we also encountered was training. Key thing to understand is they're trying to work down this backlog is you know, folks, caseworkers having to leave their desks to come to Raleigh or to a central location regionally to have training sometimes is a challenge to be able to continue to meet their day-to-day requirements. So what we have done is we've looked at different ways to adjust that training and the methods that we provide. So we're having virtual training. We actually have our NCFAS training website that they can go to and take the training as they need. We are also doing train the trainers. Several counties have their own trainers, so they've come to Raleigh. We've taught them how to do that. We've adjusted having virtual help desks with topics that counties can identify that they want us to cover. So we've tried to adjust to all the needs of all counties, not just one or two. Some additional things that we have provided is our on-site support staff trainers that go out if there's specific needs, and we're continuing to support that staff and assist counties with our hard launch as we move forward. Other things we continue to look at is ways to improve our help desk. We've increased the staff there to adjust for our rollouts, as well as we have reprioritized so that those individuals are more specialized to be able to answer at the first call. NCFAS continues to struggle with staffing turnover. As you all know, the software solution we have is a current product, which is kind of like SAP. It requires specialized type skills. And so with that, there's other states that are moving forward with the current implementations, and they would love to have our staff because we're ahead of everyone else in this market. We have very good skilled folks from business to IT that are being recruited. So we continue to work with OSBM and, excuse me, not OSBM, OSHR, and our current DHHS HR to see if there's ways for us to recruit and retain the staff. One of the other areas that we listened to our counties as well was in our performance testing. We originally tested a subset of data to make sure that our system was performing proficiently. With communications with our counties, one of the key things that we kept hearing is every time we put a new current release in, Monday morning, you come in, the system's slow. So we implemented new processes working with IBM, who is our software vendor, to look at ways to improve that. We are now testing against a full production copy of data. And this last time, which we just went in 2 weekends ago with a new version, we employed counties to bring staff on board to assist us with our user acceptance test. We had 7 individuals from 7 different counties to come in and assist us. So that really benefited us to understand and look at what they see, and they did identify 1 or 2 things that we fixed before we went into production. So with that, I'm going to turn it over to Wayne Black.
Thank you, Angela. I'm Wayne Black, the Director of the Division of Social Services, position I've held for 15 months, having previously worked for 37 years and retired from County DSS, having served 12 years as a social worker and supervisor in Guilford County, and then a combined 25 years as the DSS Director in Mitchell County, Yadkin County, and Surrey County. What I want to talk about, as you see on the slide, is some challenges facing our counties and some things we've been doing about it. I think when we talk about challenges facing counties, first and foremost, it's volume, 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 the volume of work. As you see at the bottom of the slide, go back 5 years, ending June 30th last year, you can see that with the recession, particularly in food nutrition, which has been called the canary coal mine as far as the economy, we had a 75% statewide growth, staffing increased 27%, Medicaid growth 24%, staffing increased 4%. You can see what counties were facing in terms of challenges as we came into the process of rolling out our NC FAST products. And on top of that, within the last 6 months or so, we've had 90,000 plus Medicaid applications coming to counties, coming from healthcare.gov through the Federal Facilitated Marketplace, subsequent to the Affordable Care Act. So that's added more volume of work. In addition, applications through ePass, the electronic portal, coming into counties. I'm hearing from some counties, a lot of them, that some of those applications are not completed accurately or completely and require a lot of follow-up information from clients. So that's another issue. And finally, the new Modified Adjusted Gross Income, or MAGI, we call it, rules regulations for Medicaid, Family and Children Medicaid through the Affordable Care Act. County staff tell me that this is like learning a new program. So that, on top of course, learning the NC FAST system, at the same time, these other kinds of things are happening. I would also add that the volume of those federal marketplace applications began coming down. I think the first batch was mid-January. So counties were starting to see that volume increase at the same time that we were all working, and successfully, I might add, to meet the February 10th and March 31 deadlines for getting all of our applications and recertifications to a good place with food nutrition services. What are we doing about it? What are our solutions? First and foremost, the most important thing we've spent a lot of time in our department working on is, in collaboration with Centers for Medicare and Medicaid Services, CMS, to get some resources to counties to add resources in order to deal with the volume of work. Counties back to January 1 have had the opportunity, as allowed through CMS, to receive 75% reimbursement for their eligibility functions in NC-FAST. 50% reimbursement for EIS. So county dollars in NC-FAST is 25%, which is half of the 50% that is in EIS. We worked really hard, and I say we, I mean the leadership of the department, our budget office, our performance management section at the Division of